Hi, and welcome to the Downingtown Area School District's School Psychologist presentation about understanding your students' evaluation or reevaluation report. Let's first start with who is on the multidisciplinary team. The multidisciplinary team often includes the parents, student, an LEA, which is a representative of the school district, either a principal or special education supervisor, your school psychologist, your school counselor, general education teacher, possibly a special education teacher, and any related service providers. The purpose of an initial evaluation is to determine if your child has an educational disability, and if they do, whether your child requires specially designed instruction and/or any related accommodations in order for them to make adequate progress in the general education curriculum. Additionally, an initial evaluation will help identify your child's strengths and needs in the areas of cognitive intellectual functioning, academic achievement, behavioral and/or social emotional profile in order to make individualized recommendations for your child's educational program if necessary.
When the school district conducts an initial evaluation, there are three potential outcomes that can be the result of said evaluation. The first outcome is that the student is not eligible for special education services. In this scenario, there may be recommendations for other supports through general educational programming and/or interventions through the multi-tiered system of support process or MTSS. The second potential outcome is the student has a disability but does not require specially designed instruction and therefore is not eligible for special education services. To be eligible for special education services, a student has to demonstrate characteristics of one of the 13 exceptionality categories, as well as require instruction outside the scope and sequence of the regular education curriculum. In this scenario, a student may require educational accommodations to access their educational programming, but may not require instruction outside the scope and sequence of the regular education curriculum. These accommodations can be provided through what's called a Section 504 service agreement, which would entitle a student to having those accommodations, but would continue to require or give their instruction through general education curriculum. The last scenario is that a student has a disability and they are also in need of specially designed instruction, and therefore they are eligible for special education services. In this scenario, the student does require instruction or support outside the scope and sequence of the general education curriculum, which would be provided through specially designed instruction. This would also include accommodations for them to access their curriculum. Also to note, specially designed instruction is instruction that is delivered by a certified special education teacher and that is individualized to meet a student's particular needs. This instruction may also look like a related service provider, such as a speech language therapist or an occupational therapist. Regarding when a student is not eligible for services, an educational evaluation may also provide some insight on ways to provide best practice support for a student as well. Through our general educational programming, the district has interventions and supports through our multi-tiered system of support process. This looks like instruction through our core curriculum, as well as ways to provide supplemental interventions for a student when we may suspect that a student requires some additional support outside of the curriculum. In addition to this, we may also provide some enrichment opportunities beyond what is also provided within the core curriculum.
So the next potential outcome for an evaluation would be that the student is eligible but not in need of services through special education. So that is a little bit confusing because the student does have a disability of some sort, but they're not meeting that second prong of needing that special education, that specially designed instruction through special education in order to make meaningful progress. This might be a student who has some sort of outside disability that they've been identified with. An example might be a student who's been diagnosed with ADHD, and they are not a student that requires any sort of changed, modified programming in order to make meaningful progress within their curriculum. However, this profile of student might also be a student who does require some sort of accommodations in order to be successful. That is a possibility with this potential outcome. So students who would require accommodations in order to be successful may be found eligible for a 504 service agreement. And that would be in comparison with specially designed instruction through special education, where we're talking about changing, modifying, slowing down the curriculum for the student to be successful. Accommodations are things that we can put in place around the student in their environment in order to help them be successful. The third possible outcome of an evaluation or a reevaluation would be that a student is eligible and in need of specially designed instruction. These students require some sort of changed, modified curriculum in order to be successful, and this is a student who would have an individualized education plan developed for them. That's called an IEP, and the team would meet and get together and put a plan of support in place based upon those strengths and needs that are identified through the evaluation process.
So if your child is found eligible for special education services because they have a disability and a need for some specially designed instruction or instruction that's not occurring within the general education curriculum, they do have to be reevaluated every 2 to 3 years depending upon their exceptionality. And that is a legal mandate that the state provides us. We have two options when we complete a reevaluation. One may include gathering additional data to see if there's ongoing need for special education, or maybe there's different needs at this time because all of our students grow and change, or maybe they have been receiving speech and language services but no longer need speech and language services. But either way, we have two options when it comes to the reevaluation. We can collect additional data to see if there's any different needs or changes to programming, or we can just review their records. So how do we determine if additional data is needed as part of a reevaluation? The team, including the parent, does have to determine if we have sufficient information to say whether your child still has a disability, whether their present levels of performance and educational needs are still the same, whether they still require special education and related services. And that goes back to a student, for example, we've talked about, if they have ADHD, they may no longer need the direct instruction piece or some sort of pull-out course because of their ADHD, but they may still need accommodations. And also it helps us to determine the type and intensity of special education and related services that they need in order to be able to participate in their school day and make progress toward their individualized goals.
Next, we will talk about the review of current data sections for reevaluations and the reason for referral sections for initial evaluations. For an initial evaluation, the reason for referral section includes information regarding any concerns that have prompted the initial evaluation referral. This may include the person requesting the evaluation, along with the purpose of the evaluation. For a reevaluation, the review of current data includes a review of any previous assessments that have been administered and completed, along with any evaluations previously that had been completed, and a review of the child's current performance within their programming and classes. The reason for referral section will help drive the types of assessments completed through the evaluation process. The review of educational records for a reevaluation will also help the team to determine what assessments may be appropriate as part of the new reevaluation. The interpretation of assessment data section will contain updated information and assessments that have been deemed necessary by the multidisciplinary team. This section may include updated assessments and data from multiple educators who work with your child. This updated information may include cognitive assessment data. This will look at a child's thinking, reasoning, and problem-solving skills. This may include academic achievement data, which will look at a child's performance in areas such as reading, writing, math, and oral language skills. Social, emotional, and behavioral assessments, along with assessments of executive functioning, may also be administered, which will look at a student's behaviors across settings. So this may include information from you at home, the classroom teachers, as well as information from the child themselves if appropriate. This also may include any new related services, data, and assessments. This may include assessments from speech and language therapists, occupational therapists, physical therapists, or other providers as appropriate.
Variation from standard conditions. Assessments are developed and norms are established based upon a set of controlled conditions in an effort to obtain accurate and reliable results. Typically, assessments are conducted under standard conditions. However, situations may occur that may result in a need to vary from standard conditions. Reasons they may vary include a fire drill or a safety drill interrupting a testing session, the student becoming ill, the student given extra time, assessments were used while the evaluator or the student were using PPE, or the assessments were not administered in the student's native language, or other mode of communication in the form most likely to yield accurate information.
Educational regulations offer protection to students for not being misidentified as having disabilities when factors that are outside the child are the primary reason for their struggling to learn. In other words, these are things that we need to rule out in the evaluation process. These rule outs include making sure that the child is not identified with a disability to any of the following reasons. The first is lack of appropriate instruction in reading. The second would be lack of appropriate instruction in math. And the third is lack of proficiency in English. For example, expecting a child to quickly perform as well as their peers in their second language as they would have in their native or first language. If we indicate yes to any of these rule outs in the evaluation process, it means that the child struggling to learn is due to one of the factors above. And in that case, we would not be identifying the child as having a disability at this time if that's the primary reason. When we indicate no to these factors, it means they have been ruled out and are not the primary cause for the child struggling in school. The conclusion includes an eligibility decision by answering a two-pronged question. One, does the child have a disability? And number two, does the student need specially designed instruction? There are three potential outcomes at the end of an evaluation. If the student is found to meet criteria for both of these prongs, in other words, they have a disability and they need specially designed instruction, by answering yes to both of these, we're indicating that the child is eligible for an IEP and needs specially designed instruction. If the child meets criteria for number one, that they have a disability, but they do not need specially designed instruction, then the educational team considers if the child may be in need of a 504 service agreement or a group of accommodations that the child needs to perform appropriately in school. If the child does not meet criteria for either of these, they do not have a disability and are not in need of specially designed instruction, then the child would not qualify for an IEP or a 504 plan at this time.
If a student is found to be eligible for special education services, the recommendation list at the end of the report will outline student-specific strengths and needs, which will drive the recommended programming. If, in the needs section, the phrase direct explicit instruction in the area of need indicates specific skill instruction will be provided to the student. If the phrase states strategies to support an area of need, that typically means the team is recommending accommodations or modifications provided to support the student in the classroom. Examples might include, but are not limited to, access to quiet and reserved location for tests, extra time for assessments, or similar classroom accommodations. These strategies are typically included in the specially designed instruction section of the IEP. If the student requires consultative support through OT, speech, PT, or other related service providers, this will be listed in this section as well. If further assessments might be needed, the psychologist will list this at the end of this section of the report.
The recommendations drive the needs section of the reevaluation and evaluation report. However, not all needs need to be related to the label. The label is the special education diagnosis that you get through the conclusion of the evaluation or the reevaluation report. So essentially, needs drive the programming, labels or diagnoses do not necessarily drive the programming. Each need is identified in the evaluation and it's addressed in the IEP through either direct explicit instruction, which is remedial education in the area of need given by a special education teacher or a specialist in that area, or the need can be addressed through specially designed instruction, which are accommodations outlined in the IEP and delivered in the regular education curriculum. Data to identify those needs can be collected through the IEP process, and this can inform programming changes. This can be done through progress monitoring throughout the IEP process and does not necessarily need to be done through an evaluation or a reevaluation. So in conclusion, the needs drive the programming, not the labels.
Thank you for listening to our presentation on how to interpret your child's evaluation or reevaluation report. If you have questions or if you would like additional information about anything that you have heard on this presentation, please reach out to your student school team or visit the district's pupil services website at the website on this screen. We will be able to answer any of your questions and address any concerns that you may have. Thank you very much for your time and attention, and we hope to talk to you soon. Thank you.